Hello, and welcome to The Mind of a Therapist, a podcast where we interview psychotherapists and helping professionals what they are passionate about in order to provide you with messages of encouragement and hope. The Mind of a Therapist is sponsored by Psychological Counseling Services, PCS, Healing Hearts and Transforming Lives. Please look into our intensive program at pcsintensive.com. I am Dr. Marcus Earle, the Clinical Director of PCS. Each episode will be hosted by me or another PCS therapist. Please enjoy the following discussion.
Hello, I'm Dr. Erin Buggy, and I'm one of your hosts today.
And I am Alethia Wood, her second half today.
That's right. And we are here today to have a conversation that takes a look at mental health, which is our area of focus, and its relationship with maternal wellness.
Mm-hmm. And so today we're joined by Dr. Michael Hervey. Dr. Michael Hervey is a St. Louis native. He began his career in the U.S. Navy before studying biology at Morehouse College and earning a master's in biology from Harvard University's GSAS. He went on to complete medical training at the University of Virginia, followed by a family medicine residency at the University of Minnesota, where he received multiple teaching awards. After additional experience in critical care, obstetrics, and rural medicine, he completed his OBGYN residency in Phoenix, again being recognized for clinical excellence and teaching. Today, Dr. Hervey has developed a robust integrated women's care model that explores the support of both mental health and primary care for women throughout their pregnancy and beyond. Rooted in compassionate care, Dr. Hervey has collaborated with his wife, Ellie Tan, certified nursing midwife, UHNPBC, to develop Premier OBGYN Team Baby Catcher. Together, they combine their education with research-based experience to form a unique care team that provides service to over 4,000 women in the Valley. Dr. Hervey is outspoken about women's health care and demands only the best for his patients. Yeah. So welcome, Dr. Hervey. We are so glad that you could join us for this conversation today.
Well, thank you for inviting me. It's, again, an extreme honor to be on this platform and to talk about exciting things like women's health care as well as mental health. So thank you again for inviting me in.
Yeah, well, thanks for being here with us. If you could just share a little bit more about your practice with our listeners. We are eager to learn more about you today.
Gosh, thanks. I think you said a lot there, a lot more than I would ever say about my practice. Yeah, I'm really honored to work with the midwifery team that I'm working with. They're really passionate about women's health, clearly. It really started off with my wife and I, as you've already stated, and she came out of midwifery school, and we just looked around the Valley, and we didn't find anything that quite suited what she wanted to do and what I wanted to do, and it just made sense to collaborate and develop something. Never thought it would grow to the size it is now or wherever trajectory it seemingly wants to take us. Our whole purpose was simply just to be team baby catcher, husband and wife catching babies. But one of the things that was really exciting about her being a part of the team was, she really slowed down a lot of my traditional kind of thought processes around women's health, helped me to understand that the educational piece is just as critical as that medical piece. And that's what midwifery does really well. They support moms, women, families in some of the most vulnerable times, and they understand that purpose in that. I think trained as a allopathic doctor, I understand the medicine, but I didn't take the time to understand how teaching physiology, even thinking about sitting in front of a 20-year young individual and reviewing with them their anatomy, right? There's so many young women who don't even ever look down there, so to speak, right? So, so these types of things came to the forefront to me, and from there we just blossomed and grew into where we are. This year was our big year to kick off. We've been talking about it for many years, but kick off mental health in our department. We have a I would say part-time, full-time mental health specialist here who is focused on maternity care, women's care, before, after, through pregnancy, infertility. We're aligned with reviewing medications and diagnoses, and there's a collaboration between them or that side of the team and us to sit down and talk about and work with patients to help them through these processes. So we're really excited about where we're going and helping in this same area that you guys are interested in with mental health.
Now, incorporating the mental health side of things, that's something you had wanted for a long time. Is that something that you see as maybe uncommon in a typical practice like yours?
Great. Absolutely. I don't know of another practice that has a dedicated individual like we do. I know family medicine, where I was trained, always had a mental health kind of arm. And, I found that clearly to be beneficial, maybe a little bit underutilized in what it could do. And so, having had that background and seeing it and being able to bring it here, I feel like our focus was more, I'm using the same word to describe the same word, but was more focused. And that focus allows moms and families to feel safe and secure when we sit in rooms and talk about mental health support and mental health needs. There's no judgment. There's no shaming. There's no other emotions that make it difficult for a mom to proceed. And to date, whenever I mention it to a patient to say, hey, maybe we should sit down and talk to Carrie, who I think you guys are going to have an opportunity to meet and talk to on your panel, families, moms, husbands, they all seem to really gravitate to it. So it's really been an amazing feature to add.
Yeah, super important. I think, Erin and I are both moms and we've had our share of pregnancies. For me, many of those, almost all of those that you have been a part of. And it's such a sensitive and vulnerable time and so important to have that mental health piece on board. So I'm excited to hear that's going on for you guys.
The perinatal years, too, are a time where a lot of mental health dynamics that maybe are, kind of bubbling under the surface come up and begin to present more strongly. So I love hearing that you are incorporating that into your practice because you have so much interaction with these individuals who might be having these intensifications.
Yeah. We all know that moms are kind of the gateway to health and wellness for their families.
Yeah.
But they're also dealing with a lot of their own challenges of stress, and sometimes they lose the sense that their health is important at times, or they're a sacrifice for children, or sacrifice for a husband, sacrifice for the family. But when we have them in this captive audience and we do our EPDS scoring and we sit elevated and we say, you should go see someone or whatnot, 2 hours later, they're already back to being sacrificial for everyone else, but not themselves. And so being able to have it here, again, we found that was just a critical piece. And then it's all connected. Their midwives, myself, or the other providers with Carrie. Amazing.
Yeah, that's huge. In a period of time, the perinatal years where stresses and demands go up and sometimes supports and resources go down, it's often in that gap
Exactly right.
where we see kind of long-term negative effects and trauma. And so you being able to notice when there's, a gap there and helping to intervene and connect
Right.
with resources is really significant.
Yeah.
Thank you.
So you just came out with a new book, Her Body, Her Baby, Real Stories of Autonomy in Childbirth. We really enjoyed it. Great read. Will you tell us a little bit about the book and what gap in the maternal health conversation you were hoping to address with that?
Oh, man. Gosh. Can I be a little bit personal? Alethia, you've already made mention that, we know each other personally and from, your experiences. I'm not going to go into any details, but I want to thank you. Can I start there by thanking you and letting you know this publicly, that you're probably one of the individuals who led me strongly down the path of breech delivery, right?
Yeah.
You were one of my very, very first many, many years ago. So if you recall our conversations, our communications back then,
Yeah.
this is where that book came from. It came
Mhm.
from the idea, concept that mom's coming in saying birth is normal, birth is natural, birth is common. Yes, we've got medical technology to be able to help us and take care of us when there's dangers, but when things are good and healthy, why can't we be allowed to or be in a position where we're able to, birth naturally as we possibly can, right?
Mhm.
As long as there's the parameters of safety around there, birthing naturally, not being forced into a C-section or not being forced into care that ultimately might actually cause harm, not just
Mhm.
physical harm, mental harm, right? So all those things are what spawned the book and what the book is aimed to do. There are many points in the book where I said, well, for myself, for example, maybe I wouldn't personally do X kind of care. I'll say something like have a VBAC after many, many C-section, but a mom who hasn't had the opportunity to deliver vaginally and was forced into multiple C-sections. And there are cases where that happens very
Mhm.
vividly. And I think those moms come in and they have a challenge working through the system. And so the system shouldn't alienate them. The system should find ways to welcome them and find ways to find safety around the care that they're looking for. And that's my goal from the book. It's simply to be able to allow the moms to have a voice, to be able to communicate, to allow providers to see, hey, there's a way to do this, and that doesn't jeopardize your practice, doesn't jeopardize your safety, doesn't jeopardize your care, allows you to be there and support them, but also know when to transition and say, hey, we moved down this path. It's not going well. We can transition now safely, but we've had the opportunity to explore it, right? So
Mhm.
those are kind of the thought process behind
Yeah. Yeah, when I think back to that birth that we went through together and with Ellie as well, it really
it.
is one
Yes.
of the most empowering experiences of my life, right? Because I had a choice in the midst of a really vulnerable season as a mom, a really vulnerable season in my life in general. And I really felt the support from you and from the team that I had choices in that moment. And I could trust myself, I could trust my body. And that you guys were going to be there with me along the way to keep us all safe. And he is 9 years old and thriving. So, yeah,
Love it.
yeah.
Yeah, that's awesome.
The word choice is a really important one.
Yeah.
When we're thinking about trauma and how it takes hold, one of the key features of a traumatic experience is a sense of powerlessness and a lack of
Mhm.
agency. And so, in some of those circumstances, whereas you had said maybe a parent is forced into a C-section and you remove that sense of autonomy and agency and empowerment, that can really have significant negative effects.
Yeah.
Absolutely. Not just short-term, long-term challenges mentally, emotionally. And, just not too long ago, I was with a young lady who successfully VBAC'd after 2 prior C-sections, which is standard of care, appropriate, and should be allowed, but not all doctors do from their own biases or whatever the case may be. And I said, why did you have your first C-section? Well, I had high blood pressure. I came into the hospital. My blood pressure was high, and they said I had to have a C-section. Well, I said, well, and we all know that is not an indication for C-section. It's an indication for delivery, but it's not an indication for C-section. And then, of course, once that happens, and once a C-section, another C-section, forced to have another C-section, never given a chance. Well, finally, she found me. I found her, however that happened, and she came in for her vaginal birth after C-section. I mean, you could feel the tension in a room every time her blood pressure went off, every time something happened, because she knew that she was going to be forced into another C-section because she had high blood pressure. I said, no, you don't. You're okay. You're safe. And gosh, I've never seen somebody push out a baby so well, so easy, without any decelerations, nothing. But I didn't have to do anything. Her body was ready to do it. It knew what to do, but it was never given a chance before. It was redemptive for her, redemptive for me in a lot of ways, to know that we can trust each other in this healthcare system.
Yeah. Yeah. In therapy, we talk about having corrective experiences, and being able to have the kind of experience that she had is very much a corrective experience, which can be offer so much resolution and healing on the psychological level, the emotional level, and even the physiological level.
Absolutely. Yeah, I agree.
So, in the book, you talk about the value of informed consent without coercion. So, how do you hold this tension between safety and autonomy when those seem in conflict, maybe?
That's a good question. That's a really good question. Gosh. I hold this truth when you deal with childbirth and maternity care. Not one mom, I can't say not one mom, I will say, not one mom walks into my door, through my doors, and wishes, hopes, or desires a bad outcome for themselves or their baby. Period. Everyone, whether it be the medical system, whether it be family and friends, that mom and partner, they all want the same thing: a healthy baby, healthy family, healthy circumstances, healthy environment, etc. So you work from that premise, and then you go from there, and it's about providing detailed consent, not fear-mongering, not, for example, the example that stands out to me is ECVs, external cervical version, right? Turning a baby that might be breech. And I have so many patients come to me and they'll say, well, my doctor doesn't want to do the ECV because they think it's going to stress the baby out, or it's going to cause an emergency C-section, or the placenta's going to erupt, or it's going to, and the list goes on. That's not consent. That's putting upon your own wishes or your own thoughts, your own fears, if you will, to the family, and veering them down a path that you want them to do, coercing them down a path you want them to follow. Informed consent is to say very clearly, these are the risks. The risks are placenta abruption, uterine rupture, labor. It doesn't work. Expressing to them, when it does work, it works quick, it works fast. It is safe. It's the standard of care. Otherwise, it wouldn't be offered, right? If it wasn't a safe option for you. Expressing to them that that we do it in the hospital. We do it in the hospital, not in my office, because we need to be in an environment that if there was urgency, that we can make that transition. And I need to have permission to make a transition quickly if there is urgency when we attempt to do this. And so you set the stage where they say, well, doc, I heard everything you said. I don't want to try that. I'm worried about it. But they know that there's safety around it. Or, doc, I heard everything you said. It sounds like it's an okay option for me because I feel so strongly. My strongest consent to a patient is this, and I use this verbatim over and over and over again. And I tell patients there are two families. First family says, doc, we worked 9 long months to have a healthy baby, healthy family, healthy circumstance, healthy environment. Doc, I will suffer whatever I need to suffer to know that my baby, my family is okay and safe. And that family might choose a more traditional path, might choose to move directly toward a C-section route. Then there's a second family that says, Doc, if I suffer through that C-section or whatever the case may be, medications for mental health stuff, Doc, if I suffer, I don't know that I'm going to be okay mentally, emotionally, physically, spiritually, culturally for my family. I don't know that I'm going to be a good mom. I'm going to be a good partner. Doc, can I just try? Can I attempt? I understand the urgencies, and I understand that there's a chance I might need to transition my goals or my plan or whatever. But Doc, I just need to try, know that I did everything I did first before I do X. Those are two very distinct decision-making points or diversions that allow people to really figure out who they are in that moment when they have to make that hard decision.
Yeah, I'm really hearing the value of having all of the facts laid out in front of you and being able to make a choice based off of the facts that you're presented with, and letting people make choices and own their choices as being what's right for them. And I think that's something we really work to do in our profession as well, is help people explore and understand their different choices, and then be able to be from an empowered place of knowing themselves, be able to make that choice because they would know best, not us.
Yeah.
And without the overlay of one's own fear or worries, which in the initial example you gave, it seemed like it had a fear-based component to it. Here's all the problems.
Yeah. I agree. Lead with the knowledge and information. And again, like I said, trusting that everyone who walks across the door, your doorway or into your office or whatever, we're all looking for the same outcome. And that outcome is healthy moms, healthy babies, healthy situations. No one wants bad or risk or danger. We all want the same thing, but we all find it differently. And like anything in life, we all are going for the same goals, but we get to that path, get to that goal, very different.
Now, because every pregnant person can't come see you, right, for their care, what are some signs that our listeners could look for to know whether their care team or potential care team is respecting their choices, their autonomy, approaching consent in, a mindful way? What do you hope people are looking for?
Oh, that's tough. Unfortunately, when I came out in practice, I joined with Dr. Mitchell. And I don't know that he'll ever hear this communication, but I mean, he was a godsend in so many ways on his ability to be open to alternatives and options. He did a lot to help me with my forceps deliveries that a lot of docs don't do anymore. He was a very significant to my breech deliveries. My first few deliveries, he was always there present to kind of back me up, if you will. He never shunned me when I said, I'm thinking about going down that path and offering these services when asked. I don't offer it to patients. They come in, they ask. And that's when we'll walk down that path. So he was very important in that fashion. So, and I never worked in an environment where I saw or was able to see some of those negative behaviors that would be alarming. I think to myself of a provider who said to me, the worst part of his day going into their clinic is having to sit down and have conversations. Every time I sit down with a patient, it's a conversation. It's a relationship, right? And I enjoy that relationship. I want to know more about them. I might start off my communication with them. Tell me something good. Tell me something new. Tell me something that's going on that's not clinically associated with what we're here for. I want to have a relationship with you so that we can grow from there and both have understanding about who we are as individuals. And it's easier at that point in time to talk about some of the hard conversations when there's a relationship. That's number one. So relationship stands out to me. Number two, if you know that there are options and your provider is only talking about this is the way we're doing it, or this is how it's going to happen, and there's no back and forth communication around any level of the care plan, I think that's also a red flag. I've started doing some of my C-sections when I do a breech C-section because mom has chosen that's the way she wanted to go, or the route she wanted for her delivery versus out of a ECV or a breech vaginal birth. And I will tell them, hey, you should be allowed to have a trial of labor. And if your provider, whomever they are in your next delivery, says, oh, once a C-section, always C-section, stand up and walk out, because that's not the standard of care. You've never had the opportunity to trial for a labor. Your baby was breech. There's no evidence that the pelvis isn't appropriate, that you have some other medical or physical ailment that would inhibit your ability to have a vaginal birth. So you should be offered the opportunity. I think those are things that stand out to me. But relationship is probably the biggest.
Yeah, I'm hearing one, just so important to be with somebody who wants to know you. I mean, you're building your family. We should know each other. And
Yeah.
we're going to walk through some of the most vulnerable, special,
Memorable.
points of our lives. Like, let's get to really know each other. And I'm also hearing just not being put in a box, that each of us just has a right to decide how we want to go about this process of giving birth, and to have all of our options on the table to make an educated decision, and how important that just autonomy and that right to choose and being offered that is really important. And I think that really affects mental health outcomes as well. The ability to choose. Certainly we've seen that in our practice, that when choice is taken away and you're forced or pushed into something, that can be really harmful. And not just to the mother, but to the other members of the family as well. It can be very traumatic to watch that unfold and to not understand what's happening, to not be able to give consent. It just can be a real struggle.
Yeah, that relationship piece is, I love hearing you say that, because it's so significant. If we think back to supports versus demands on the system, and you think about how many demands there can be on somebody's system at every level during the labor and birth process, if there is that relationship that you have, that is going to close the gap so much so even if things get really difficult, you have a much better balance of support in place to kind of buffer against that.
Yeah, I agree. And I love how you said that, because that's exactly what I was thinking. I mean, because sometimes, unfortunately, in what I do, there's not an opportunity, right? You walk into and you see a mom and in the triage, and the heart tones are down, and baby's in trouble, and you walk in and say, hey, we've got to move to a C-section. We got to go now because your baby's not doing well, right? And it's a split decision, but that relationship where that patient knows that, we've talked, we've communicated, we all have the same goal of a healthy baby, healthy mom. They know that your provider cares to consider your wishes and goals. But in that moment of true urgency, we have to move. It helps bridge those difficult moments and help them go a lot smoother, a lot quicker. I can't tell you how many times people have come against, real rigid environments, and we've got to go now. And the family's like, no, we're not, because they don't trust the system. They don't trust their provider, and that relationship is not there. So,
yeah. And that relationship can mean the difference between having had a difficult birth and having had a traumatic birth.
Yeah.
Right?
Correct.
Big difference.
Yes, I love that. I love that. Yes, absolutely.
Yeah, I think we've experienced one of those together, where we've had, an emergency situation and a difficult birth together. And I would say, yes, the relationship that I had with you and with Ellie was really protective in that. Not just protective for me, protective for my husband. I think when he talks about that day, he talks about Dr. Hervey took a minute and I didn't know what was going on. And he stood with me. He explained to me what was going to happen next. And we were rushing. We heard you running down the hall to get to me. but that relationship, like I felt so safe. I knew that you knew me, you knew what I wanted, what my needs were. And you really paused, even just in the OR as we sat there and, under a lot of stress, to just take a moment, to just take my hand and say, we've got this. And that's really, really meaningful. And yeah, I think that kept a difficult experience from becoming a traumatic one, because I knew I was in your hands and in Ellie's hands, and I knew you guys had me.
Well, thank you.
Well, as we close here, I know there's big things going on over there at Premier OBGYN. What's next for you, and where can our listeners go to learn more about your work?
Well, gosh, there's a lot of things going on, and we're excited about this new year, 2026. We have our first Empower event, and Jam, who's been working very tirelessly, is empowering women's health, women's care. We're going to have over 20 vendors there who are going to be sharing their resources and their tools to help moms, families to become more knowledgeable about prenatal, postnatal, and everything in between, mental health support as well. I think you mentioned my book. Thank you so much. I've got it here
There she
again.
is.
Great opportunity to just, again, I feel like really good stories that show autonomy. The goal is for not just for the laboring mom, it's for the provider, it's for the healthcare system even, to say, hey, we could do things a little bit differently. And so I think you can find a piece of that in there. I am passionate about birth trauma. I am passionate about birth trauma. One of the things that I found, and you look at my practice, I always ask patients, how did you find me? And they'll communicate, well, my provider wasn't listening, or I had a traumatic birth, and it was in the other book where you saw a couple stories like that. And anyhow, so this is my most recent piece I put out, Beyond the Birth Plan. When that birth plan fails, it's a 7-day guide to kind of walk through that birth experience where you can explore your emotions, your senses, all the things that happened and didn't happen. And it allows you to kind of regroup and use this as a tool to start the healing process. Healing starts immediately. As soon as you're willing to open up and have discussions with others, but yourself even more so, right? To be honest and vulnerable about what was good, what wasn't good, and who all was a part of that. I think that's where that healing process starts to begin and allows you and your family to heal through that process. So I'm excited to continue down that path. And then finally, and again, I've got the most dynamic midwives in the city. And so we are actively working to align with a lot of like-minded providers. We have a strong collaborations that's happening up in Scottsdale with a provider up there who's amazing in the same field and has the same passions as I do. And hopefully we can get out to the West Valley and do that as well to help spread the message. That's our goal.
Amazing. Well, thank you so much for joining us here and sharing more about your practice.
And the really important work you are doing.
Yeah, so important. I know so many people benefit from the work that you do. And yeah, I'm excited to see how this has just a rippling effect to families, communities, and the healthcare center. So
thank you. Thank you very much. Really, really honored to be with you, and I'm excited to see how you've grown and blossomed and all these things, Alethia. And I really am nice to meet you and thankful that we were able to have this moment. Thank you.
Please press the subscribe button, as well as rating and providing a review of our podcast. This helps others to connect with what you have been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapist. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guest, or PCS are rendering legal, medical, or clinical professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to find a licensed clinician near you.